Greetings. Welcome to the Simple and Practical Fluids and Medications Computation. I am Dr. Kasubha. Given case scenarios, you, the clinical clerks, should be able to compute appropriate fluids commonly used in pediatrics and compute appropriate medications commonly given to children. The content of this session are commonly used intravenous fluids and computation for intravenous fluids, intravenous and oral medications. First stop is intravenous fluids. In general, we use two types of fluids, fluids for hydration and fluids for maintenance requirements. This session does not include special circumstances. Fluids for hydration are D5.3 NaCl, the light blue labeled fluid, D5LR, pink labeled, plain LR, the dark blue labeled, and plain NSS, the green labeled fluid. For maintenance requirements, we use D5IMB, the violet labeled fluid, and D5NM for the orange labeled fluid. As a rule of thumb, we should always use WHO standards for hydration, but this session will only tackle on Ludan's hydration. There is a cut-off weight for the computation for children less than 15 kilograms and children more than 15 kilograms. If the child is mildly dehydrated, give 50 cc per kilogram in 8 hours for children less than 15 kilograms and 30 cc per kilo in 8 hours for children more than 15 kilograms. Recommended fluids to be given here is D5.3 NaCl. For moderate dehydration, give 100 cc per kilogram for children less than 15 kilograms and 60 cc per kilogram for children more than 15 kilograms. Give 1/4 value in the first hour, then give the 3/4 value for the next 7 hours. Fluids here are plain LR and plain NSS. But if the child has no urine output for more than 6 hours, it is recommended that you use plain NSS. For severe dehydration, give a dose of 150 cc per kilo for children less than 15 kilograms and 90 cc per kilo for children more than 15 kilograms. Give the 1/3 value of the computation for the first hour, then give the 2/3 value for the next 7 hours. For example, if the child is mildly dehydrated and with a weight of 10 kilograms, multiply that by 50 ml per kilogram to run for 8 hours. The product will be 500 ml in 8 hours. Then divide the product into 8 hours to get the drops to be given. That would be 62.5 microdrops per minute. So order in the chart D5.3 NaCl 500 ml to run for 8 hours at 62 to 63 microdrops per minute if you are using the microset. But if there is no microset and macroset is the only available regulation, divide that by 3. So that would be D5.3 NaCl 500 ml to run for 8 hours at 20 to 21 drops per minute. For moderate dehydration, again we have a 10 kilogram child, multiply that by 1000 and you will get 1000 ml or cc product. Then divide that by 4 to get the 1/4 value of the total fluid requirement, and you will have 250 ml. So order in the chart plain LR or plain NSS 500 cc, which is the stock dose of plain LR or plain NSS, although there is also a stock dose of 1 liter for each type of fluid. Then run 250 cc for the first hour. Then infuse the remaining 3/4 value, which is 750 ml, for the next 7 hours. So order in the chart D5.3 NaCl 1 liter and run 750 cc for 7 hours. For severe dehydration, using the same weight example, 10 kilograms multiplied by 150 for severe dehydration, and you will get a product of 1500 cc. Divide it by 3 to get the one-third value of the total fluid requirement, which is 500 ml. Order in the chart, plain LR or plain NSS 500 cc to run for 1 hour. Then infuse the remaining two-thirds value, which is 1000 ml or cc, for the next 7 hours. So order D5.3 NaCl 1 liter to run for 7 hours. Make sure that you reassess the patient after the first hydration of the patient. Now let us go to the maintenance requirement. We use the Holiday Cigar method. For children 10 kilograms or less, the dose is 100 ml per kilogram using D5-IMB. For children more than 10 kilograms but less than 20 kilograms, the dose is 50 ml per kilogram for each kilogram exceeding 10 kilograms plus 1000 cc. And for 20 kilogram children or more, using D5NM, we compute it as 20 ml per kilogram for each kilogram exceeding 20 kilograms plus 1500 ml. You give additional 10% if the child has vomiting, loose stools, poor appetite, and fever. Again, we use D5-IMB for children less than 20 kilograms and D5NM for children more than 20 kilograms. For example, if the child weighs 9 kilograms, multiply that by 100 as depicted in this table, and you will get a product of 900 ml. Divide that by 24 and you will get 37.5 microdrops per minute. Order in the chart D5-IMB 500 cc to run at 37 to 38 microdrops per minute, or if you are using the macro set, D5-IMB 500 ml to run at 12 to 13 drops per minute. For a child who weighs 9 kilograms but still with loose stools but no signs of dehydration, multiply the weight by 100 ml per kilogram plus 10% for the loose stools and you will get 990 ml. Divide the value in 24 so you get 41.25 microdrops per minute. So order in the chart D5-IMB 500 ml to run at 41 to 42 microdrops per minute, or D5-IMB 500 ml to run at 13 to 14 drops per minute. For a child weighing 11.5 kilograms, get 1.5 kilograms because that is the weight exceeding 10 kilograms and multiply it by 50 ml per kilogram plus 1000 ml. So that would be 75 ml plus 1000 ml, and you will get a value of 1775 cc. Then divide that value into 24 and you will get 44.79 microdrops per minute. So order in the chart D5-IMB 500 cc to run at 44 to 45 microdrops per minute, or when using a macro set, divide the value into 3. So divide D5-IMB 500 ml to run at 14 to 15 drops per minute. Using the same weight, but still with poor appetite and no dehydration, get the exceeding weight and add 10% for the poor appetite, and you will get a value of 1182.5 ml. Divide that value into 24 and you will get 49.27 microdrops per minute. Then order D5-IMB 500 ml to run at 49 to 50 microdrops per minute. Or when using a macro set, divide the value by 3 and you will get 16 to 17 drops per minute. For a child weighing 20.5 kilograms, get that 0.5 kilogram because that is the weight exceeding 20 kilograms and multiply it by 20 ml per kilogram plus 1,500 ml. So that would be 10 ml plus 1,500, and you will get a value of 1,510 cc. Divide that value into 24 hours and you will get 62.91 microdrops per minute. So order in the chart D5NM 1 liter to run at 62 to 63 microdrops per minute, or it is recommended that you use a macro set for this weight. You should order D5NM 1 liter to run at 20 to 21 drops per minute. Using the same weight, but the child still has fever with no dehydration, add an additional 10% of the value. Divide that by 24 and you will get this value. So order in the chart D5NM 1 liter to run at 69 to 70 microdrops per minute, or when using a macro set D5NM 1 liter to run at 23 to 24 drops per minute. Now we go to medications. There are two types of medications used in pediatrics, the IV medications and oral medications. Let's talk about the oral medications first. What you need to know about oral medications: their indications and contraindications, pharmacokinetics and pharmacodynamics, the half-life of medicines, therapeutic doses, preparation, amount, computation, and prescription writing. This is also true for intravenous medication. The first three bullets were discussed to you during your second year in pharmacology. But now we will be focusing on these highlighted bullets. The sources of therapeutic doses and preparation can be seen at the Nelson's Textbook of Pediatrics, the MIMS Drug Reference, or you can download it anytime. You should also be aware of the different medication cups, syringes, droppers commonly used to give medications or medicines to pediatric age groups. These are the medication cups. Notice that there are measurements or graduations in the cup, the medication syringe, the medication spoon, and the oral droppers. For example, if you are to give paracetamol, you should know the therapeutic dose, which is 10 to 15 mg per kilogram per dose, and the frequency should be given every 4 hours or Q4. You should also familiarize yourself with the preparation and amount available in the pharmacy. For drops, that's paracetamol 100 mg per ml drops in 10 ml bottle, 120 mg per 5 ml syrup in 60 ml or 120 ml bottle, and 250 mg per 5 ml syrup in 60 ml or 120 ml bottle. So how do we compute for such medication? Here is the general formula. Multiply the weight by the therapeutic dose and the reciprocal of the preparation. For example, if the child weighs 10 kilograms, multiply that by 10 milligram per kilogram per dose as indicated by the therapeutic dose, and the reciprocal of the preparation is 120 milligram per 5 ml as shown in this slide. Then cancel out the labels to get the product of 4.17 ml. It would be very difficult for you to prescribe 4.17 ml, but it is best that you round this off to the nearest amount labeled in the medication cup, which is 5 ml. Then you should check if you are giving an appropriate amount of medication. So this is how to check: amount given multiplied by preparation divided by the weight. So for example, you gave 5 ml of paracetamol, multiply that by the preparation, which is 120 mg by 5 ml, and divide that by the weight, 10 kilograms. And you will get a value of 12 mg per kilogram. When you check for the therapeutic dosing, it is within the therapeutic dose of paracetamol. So this is correct. When prescribing for it, always remember to put the name of the patient as well as the date, the age and gender, and the address where the patient lives. Then write paracetamol 120 mg per 5 ml syrup, dispense number 1 bottle of 60 ml, and give 5 ml every 4 hours as necessary for fever. Remember that you should pair your resident when giving prescriptions. Always put the license number and PTR number for PWD patients. Another commonly used medication is amoxicillin. The preparation for this is 100 mg per ml drops in a 10 ml bottle, 125 mg per 5 ml suspension in a 60 ml bottle, and 250 mg per 5 ml suspension in a 60 ml bottle. The therapeutic dose for amoxicillin is 30 to 50 mg per kilogram per day and should be given every 8 hours or 3 times a day. This is the general formula. Using the same weight, 10 kilograms, multiply that by 50 and the reciprocal of the preparation. You will get this value, 20 ml. However, you should divide it by 3 because it should be given 3 times a day. And you will get this value, 6.67. You can use 6 ml for giving the medication. So how to check if your medication is within the therapeutic dose? So the amount given multiplied by the frequency per day multiplied by the preparation and divided by the weight. So that would be 6 ml multiplied by 3 multiplied by 125 mg per 5 ml suspension divided by the weight. From here, you will get 45 mg per kilogram per day. This is within the therapeutic dose of 30 to 50 mg per kilogram per day of amoxicillin. For computation of the bottles to be used, for example, we gave the child 6 ml 3 times a day, so that would be 18 ml in a day, multiplied by 7 because usually antibiotics are given for 7 days and you will consume 126 ml within 7 days. Looking at the preparation and amount, the available preparation for 125 mg per 5 ml syrup is only 60 ml and you will have to consume 3 bottles for this. In the prescription, remember to write the name, the age and gender, address, amoxicillin 125 mg per 5 ml suspension with dispense number of 3 60 ml bottles. Give 6 ml every 8 hours for 7 days. Don't forget the signature, license number, and PTR as needed. Now let us go to IV medications. Using paracetamol intravenously, this is the general formula. Using 10 kilograms, multiply it by the therapeutic dose of 10 mg per kilogram, and you will get 100 milligrams. So order in the chart paracetamol 100 milligrams IV Q4 for temperature more than or equal to 38.5. You can give paracetamol oral for children's temperature less than 38.5. How to check if your dose is right? So 100 milligram divided by the weight, and you will get a value of 10 mg per kilogram, which is within the therapeutic dose of paracetamol. Another example of intravenous medication is ampicillin, with a therapeutic dose of 50 to 100 mg per kilogram per day, and it should be given within or every 6 to 8 hours. General formula is weight multiplied by the therapeutic dose. Using our weight example 10 kilograms, multiply it by 100 and you will get 1000 milligrams. by 4 if you will be giving the ampicillin every 6 hours, and you will get a value of 250 milligrams. So order in the chart ampicillin 250 milligrams IV Q6 after negative skin test. Remember to put after negative skin test for children more than 6 months of age. How to check if your dose is right? So get the dose, multiply it by 4 because that is the frequency given to the child, and divide it by the weight. So 250 times 4 is 1000 milligrams divided by 10 kilograms, and you will get a value of 100 milligram per kilogram. This is within the therapeutic dose of ampicillin. In summary, you know how to compute fluids and compute medications. It is best that you practice how to compute medications. So when given a patient, you know how to compute for intravenous fluids, oral medications, and intravenous medications. Thank you.